everyone, and welcome to today's meeting on WASH and emergencies. We will give people a couple of minutes to join. So in the meantime, please go ahead. You can connect to interpretation. At the bottom of your screen, you will see that there is an English or a French button. So you can choose to follow in either English or French. We'd also love to hear from you, where you're calling in from today, your name, your organization, and as we wait for a few minutes as others join. Good morning, good evening, good afternoon, depending on where you're calling from. I'd like to go ahead and welcome you to this meeting. Please take a moment to select a language. You can click interpretation at the bottom of your Zoom window and select the language that you would like to hear. We are offering English and French during today's meeting. We'd really be interested in hearing where you're calling from today. So if you can drop your name into the chat box, maybe which organization you're with, as well as where you're calling from. Great, I'm starting to see we have close to 50 people on the line. So we just might give it one more minute and then we will start today's meeting. Great, thanks so much. So we're over 50 people that have joined the meeting. Again, I'd like to welcome you to today's meeting. My name is Nicole Weber, and I'm the WASH Technical Director for a USAID BHA-funded project known as ProWASH and Scale. So we work with partners on capacity strengthening, learning, and research. And we are excited today to be offering today's meeting in partnership with BHA. This is an opportunity for us to have some more FaceTime with BHA WASH advisors. So today, please go ahead and select interpretation, and you can introduce yourself in the chat box. Next slide. So welcome. Today's objectives are really an opportunity for BHA WASH emergency partners to engage and interact with BHA's WASH advisors. We also want to use this space to share best practices and questions with other peers around the globe. So many of you responded to the invitations that we sent out with representatives from different organizations, as well as a wide range of geographies. And so we found that this would be a good opportunity for you to connect, have an opportunity to talk to each other, but also with BHA. Next slide. So today we're starting with a brief welcome. We will then meet BHA's WASH team. We then have a presentation from BHA on their WASH research and capacity strengthening agenda. We'll then take a quick break into breakout rooms to have a networking activity. We will then hear from two partners that are already engaging with BHA on their WASH research and capacity strengthening agenda. This will be Tufts University and COST. Then we'll hear from BHA on how to stay involved with the agenda. And then we have a ranking exercise that we would like to do with you to hear from you what your priorities are for future meetings. It's anticipated that we will hold these meetings with partners about every 6 months. So we're interested in hearing from you what you'd like to talk about at our next meeting. I will now turn it over to Melissa, the BHA WASH team lead, for opening remarks.
Thanks so much, Nicole. And I want to give a big thanks to ProWash Scale for helping us facilitate this session, which is our first global BHA WASH partners meeting. It's something we've talked about in the team for quite a while, and we're excited to finally pull it together and have this opportunity. And it's really, as Nicole said, intended to open up the channels of communication to get some direct feedback, hear concerns. And we also know that we have a lot to learn about holding these. So we will be interested in your feedback later on of what worked, what didn't, what would be helpful. So just a warm welcome. Good morning, good afternoon, good evening. Thanks so much for taking the time out and joining us. And with that, I will turn it over to Precious to talk a little bit more about the WASH team.
Yes, good morning, everyone. Thank you for being a part of this event. We appreciate your time and look forward to further engagement and relationship building with you. My name is Precious Sanko. I'm a WASH advisor with BHA. I provide technical support to our West Africa region. I am, as you can see on the slide, I'm joined with several of my WASH colleagues for this event. Some, though, are not present and are on TDY. We are a team of 10 technical experts with backgrounds in civil and environmental engineering, as well as public health. We're also joined on the next slide by our program support team, Jonathan Hamrell, who's our AOR for all of our WASH awards, and also Daniel Bucolo, our program assistant, who is currently on TDY, but is joined with Abigail Jones, who is on this call and will be stepping in for him currently. So on the next slide, you'll see some of our key roles and responsibilities listed. And as I can just quickly just give a summary, we participate and network at global events which impacts the WASH world. We provide technical support to WASH application reviews and learning awards. We are also the BHA lead in developing technical and integrated WASH guidance and strategies for our multi-sectoral programs. On the right-hand side of the slide, you'll see that each advisor is a point of contact for a particular region. Although we have regional POCs, WASH advisors are spread throughout the world, providing technical in-country support to our mission, colleagues, and BHA partners. Please reach out to us on any country using the general BHA email at the bottom of the slide. We look forward to continual engagement with you, whether in country or virtual. I will now hand over to my colleague, Matt Bentley, to give an overview of our BHA WASH research and capacity strengthening agenda. Thank you.
Hi, everyone. So glad that you all are here. My name is Matt Bentley, and I'm a WASH specialist with the BHA WASH team. And I'm really excited to talk to you today about our WASH research and capacity building agenda. This is something that we've been working on over the past couple of years, and it's intended to be a guide for us to guide our investments over the next 5 years to tackle critical gaps in WASH knowledge and practice. This process was very evidence-based. About a year ago, we completed a literature review, key informant interviews, review of other WASH strategies and agendas, and held internal discussions and workshops to determine what our priorities were as a BHA WASH team to fund for global awards around research and capacity building in the WASH sector, humanitarian WASH sector. So we've separated our priorities into research and into capacity building priority areas. Before we move forward, I think it's helpful to have some common definitions around what we mean when we say research and capacity building. So we have some simplified definitions here. So we define research as actions or activities that address a knowledge gap. And capacity building are actions or activities that address a practice gap. There, of course, is overlap in many activities for research and capacity building, and we expect many activities to do both. But for our purposes, this is how we're defining these as we identify our priorities. Next slide, please. So before we get into the priorities themselves, we have 4 cross-cutting principles that I'd like to share with you all to guide our work. So the 4 principles that we identified that should be incorporated in all of the awards that we fund at the global level are these 4. So first is resilience. We expect all of the activities that we fund to enhance resilience within a humanitarian context. The second is localization. We expect our partners to prioritize local partners, as well as local perspectives and approaches in programming. The third is coordination. We expect partners to be well coordinated within the WASH humanitarian sector, particularly with the Global WASH Cluster and other WASH partners. And the fourth is integrated approaches. This incorporates both technical approaches, so integration of health and nutrition in a public health integration lens, but also integration of disability, age, and other considerations as well. Next slide, please. So now we'll get into our specific research and capacity building priorities, starting with our research priorities. Remember, these are priorities that we've identified as gaps in the humanitarian WASH sector to address a knowledge gap specifically. So we have these broken up into 3 distinct themes. The first theme is building the evidence base for humanitarian WASH interventions. And there are 2 research priorities under this theme. The first is WASH non-food item design and effectiveness, both kits and cash. So understanding how these NFIs are designed, packaged, what their effectiveness is, how to improve that, and considering when kits or cash might be most appropriate. The second is timeliness and targeting of WASH interventions. This is to both baseline how timely or how speedy the delivery of WASH interventions are, as well as how targeting affects the speed of service delivery and the impact on the WASH interventions. Next. The second theme under research is WASH in integrated public health programming. This theme is really to work together with our health and nutrition colleagues to address each of these areas. But we see gaps first in WASH response to outbreaks in humanitarian contexts. So understanding and improving WASH integration in outbreak response. And the second is wasting prevention, treatment, and recovery with WASH. So better understanding the role of WASH in nutrition and wasting prevention, treatment, and recovery. Next, please. The third research theme is infrastructure interventions. There are quite a few knowledge gaps around infrastructure, and so we have 3 research priorities under this theme. The first is operation and maintenance in emergencies. How can we improve operation and maintenance, and what approaches are most appropriate in these contexts? The second is infrastructure construction and repair interventions. This is to better understand the durability of WASH infrastructure and what approaches might be most appropriate in emergency response to repair and construct infrastructure to meet needs in the most effective way possible. The third is fecal sludge management in emerging contexts. We see significant knowledge gaps around the most appropriate approaches for fecal sludge management in humanitarian contexts. Next slide, please. So next, I'll go over our capacity building priorities. Remember, these are priorities to address a practice gap. So these are areas that we see there's information available, but there's a gap between knowledge and practice. And so activities under our capacity building priorities would address those practice gaps. So the first theme, again, here we have 3 primary themes for our capacity building priorities. The first is WASH sector technical capacity. And we have 4 priorities under this theme. The first is water quality proficiency at field level. So understanding and improving water quality monitoring and understanding of water quality at that field level. The second is transformative approaches for operation and maintenance. What can we learn from existing approaches in O&M, and how can we apply those most appropriately in humanitarian contexts? The third is psychosocial support in WASH interventions. We understand that crises have an effect on the psychosocial status of affected populations. And so understanding how that impacts WASH interventions and learning from others who specialize in this to improve our WASH interventions with an understanding of the way that this impacts our programming. The fourth is building capacity of local water and sanitation authorities and utilities. Next, please. The second capacity building theme for us is improving response quality, timeliness, and accountability. And so the first area here is response quality and accountability. This is very much in line with global WASH cluster priorities. And the second is vulnerability assessments of utilities and large-scale infrastructure. We believe that if we had vulnerability assessments and work in this area, it would improve the quality, timeliness of WASH programming in these contexts where large-scale infrastructure and large utilities are affected by crises. Next, please. The third capacity building theme is, sorry, this is a typo. This should be knowledge and information management. So under knowledge and information management, we have three capacity building priorities. The first is research into practice. So improving the pipeline from research into implementation. There's a lot of research, but it often takes a long time for it to get uptake at the field level. And so improving that pipeline is a priority for us. The second is utilization of data. As you all know, we all collect a lot of data in the humanitarian sector, but some of that data goes unused or is not shared or managed effectively. And the third is needs assessment and intervention targeting. So improving the way that we conduct needs assessments and how we target our interventions. And that is all for the research and capacity building agenda. Thank you all, and I will pass it back to Nicole, I believe.
Great. Thanks so much. So we have a couple of minutes for questions on the research agenda and research and capacity building agenda. And so I want to invite those on the line to drop questions into the Q&A box. I think one question, maybe I can get us started, that I have is, where would be a good place for partners to go to learn about some of the outputs from the research and learning agenda? So we have a couple of partners who will be presenting today, but how best can I find, for example, information on who's doing research on NFIs or, who might be working on capacity strengthening for drinking water?
Great question. I'll do my best to tackle it. You can always email us if there's something you're interested in, but we are working on ways of centralizing some of the information around our research outputs. USAID has a broader action research initiative that we are currently working on rolling out. That's in collaboration with the Center for Water Security, Sanitation, and Hygiene. And so we expect that we'll be producing some outputs on that site over on Global Waters. So that would be one place. We're still working on that, but that would be one place to look in the future. Melissa, do you have anything you'd like to add?
Thanks, Matt. I think you did a great job, and I was going to I'll pull up the link to Global Waters and drop it in the chat. Thanks.
Thank you. We have a couple of questions that came into the chat box. One, can we include research and capacity building initiatives which fit with what Matt has outlined in our BHA concept notes, or is the research and capacity building funded separately? The second question is, how does climate variability and change impact on WASH? How will that be addressed in both research and capacity building?
Those are both great questions. I'll start with the first one, and we will address this a bit later in the presentation as well on working with BHA. But we, as many of you know, we do take unsolicited concept notes for research and capacity building activities that are global in nature. And so you can always submit a concept note to us. We'll provide more information on how to do that later on in the presentation, but certainly you can take these themes. These are things we'd like to fund as funding is available. Of course, submitting a concept note is not a guarantee of funding, and it's very dependent on our budget and other programs we have going on at the time. But these are areas that we would like to fund. So if you have ideas, please feel free to send those to us as unsolicited concept notes. There are other ways of getting involved as well that we'll talk about later through competitive mechanisms and things like that. So I'll save a little bit of that for later. And then climate variability and climate change. We all know that's a big topic right now in the WASH sector. That's something we care a lot about at USAID. And I neglected to mention, under the resilience principle that should be encapsulated in all of the activities we fund, climate resilience is one of the key priorities under that principle. And so we do expect that our programs should be enhancing resilience generally, but specifically around climate. So that is something we care about and are aligned with in terms of our broader USAID climate strategy. Thanks for that question.
Great. I also see Jamal has raised his hand, asked a question. Jamal, do you want to go ahead and unmute?
Yeah. Hi, everyone. My name is Jamal Shah. I'm from UNICEF New York headquarters. My question was on resilience. I mean, you answered the part which I actually wanted to ask about climate resilience. But I mean, if you think about resilience in broader term, it's something which should encompass activities before an emergency strikes. So it's like preparedness and so my question was that would BHA be interested in something which is the broader resilience? I mean, supporting FCV countries, fragile and conflict-affected countries, particularly fragile countries which are not yet in a typical humanitarian situation, so that we can develop capacity in those on those lines. Thanks.
Great question. Thank you. And yes, recognizing that their resilience is quite broad. We have limited funding and limited resources, but there are, I think, key areas around preparedness. I think for us, our agenda is highly focused on humanitarian contexts. And there are many areas of the world that are becoming more and more fragile. Those are not to be neglected, but our primary focus is the areas that are already experiencing a lot of crises. And one of the capacity building areas that your comment reminded me of is vulnerability assessments for utilities and large scale infrastructure. That's one area that might be classified under that kind of preparedness resilience, understanding how natural disasters impact that infrastructure and being able to understand the vulnerabilities and how to prepare for those. So that would be one area, but certainly, other capacity building and research priorities encapsulate some of that resilience piece. But yeah, I'll leave it there. Hopefully that answered your question.
Matt, I'll add a little bit onto that. So I completely agree with everything that Matt said. And some of our country programs do build in some preparedness and resilience work. And so, again, you're welcome to reach out to us to kind of ask about specific countries, and we can link you to what we call the GEO offices, our field and DC-based regional and country-specific programs to explore that a little bit further. But we do have particularly highly vulnerable countries where we know that whether it's from climate change or other ongoing natural disasters that occur regularly, that there will be programming for that. We are quite challenged, as Matt mentioned, the budgets are extremely tight these days. There have been periods where we've had a little bit more flexibility to do more preparedness, more DRR work. That's been a little constrained. It's looking constrained in the coming year, but again, specific contexts may have a little bit more flexibility to address that.
Thanks.
And noting that there are quite a few questions we haven't gotten to, I'll try to address as many of those in the Q&A box as possible. Over to you, Nicole.
Yeah, great. Thanks so much, Matt. And yeah, definitely. I see some people have dropped questions in the chat box. If you wouldn't mind just putting your question in the Q&A, that way Matt and Melissa can continue to answer those as we move to the next piece of our agenda. So as we noted at the beginning, there are two objectives of these meetings, one for better connections and engagement between WASH partners and BHA WASH advisors, but also we want to help support creating a community between BHA's emergency implementing partners. So we want to now give an opportunity for you to talk to some of your colleagues that maybe you haven't had a chance to connect with before. So we're going to send you out into breakout rooms for about 10 minutes, and you will, in your breakout room, share your name, your organization, the country you work in, and also one thing that really resonated with you about BHA's WASH agenda. Maybe there are things that you are already working on or that you've identified as challenges in your work. Perhaps there are new things, but just give you an opportunity to talk to your colleagues about what we just heard from Matt. When we come back from the breakout rooms, we'll then hear a little bit more from BHA or from our partners, from a couple of partners on their work with the strategy or with the agenda. Apologies, with the agenda. So as well as feedback for BHA. I would encourage you to put any more questions you have for BHA or feedback that you have on the agenda in the Q&A box. That way they have an opportunity to answer those as we continue with today's meeting. So next up, we would like to highlight a couple of partners who are already working on BHA's research and capacity building agenda. I would like to first introduce Danielle, who will talk about her work on incorporating research into practice.
Hi, thank you so much for everybody being here and for organizing this. If we can go to the next slide. My name is Danielle Lantain, and I'm at Tufts University. And we know that currently there's an unmet need to identify and fill research gaps in humanitarian response and to incorporate research that is existing into practice. So Tufts has funding from BHA in collaboration with the Global WASH Cluster in Geneva and its partners, and aligning with the roadmap goals. We are kind of beginning and in the middle of a grant to translate existing research to practitioners and reduce barriers to conducting WASH monitoring and evaluation and research in humanitarian emergencies. Next slide, please. There's 4 components to the project. The first is there's an existing resource center of research on the Global WASH Cluster website that we're expanding. We're staffing a research help desk. We're running a research webinar series, and we're doing trainings on conducting monitoring and evaluation research to LMIC institutions. Next slide, please. I'll talk a bit about each of these, one slide on each in the kind of 7 minutes I'm talking today. So for component 1, the Resource Center, the goal is to update and expand the current Resource Center to support evidence-based WASH and improve the user experience. We're writing easy-to-read summaries of individual documents and topic areas. There's about 300 manuscripts and documents on the Resource Center that are regularly searched and updated based on selection criteria. We want to add including templates and tools needed to conduct M&E monitoring and evaluation and research to this resource center, and we want to expand the open access components. So we're kind of in the process of working with the Global WASH Cluster on that right now. Next slide, please. And so the second piece is we're staffing a research help desk, and we welcome inquiries on monitoring and evaluation research in humanitarian WASH. We're responding to all kinds of inquiries, help with developing and writing grants, project design, literature review, data collection tool, reviewer support, analysis support. The two biggest questions we're getting so far right now are help with data analysis and presentation, and also just requests for tools, example surveys, example focus group discussions. We have people reach out to us asking for that, and we're happy to kind of send that on. And you can access that either via emailing globalwashcluster@unicef.org, who are partnering within this, or my email, which is also included in this presentation. And the next slide, please. This is just some examples, and maybe if you can click through the slide. We worked with an NGO who wanted to conduct a MHM needs assessment and collect additional data. If you can just click through the whole slide, that would be great. Thank you. To advocate for government support for MHM, we shared information on how to conduct focus groups, key informant interviews, and examples of existing MHM tools used in research. We also worked with a WASH cluster who wanted to research water trucking with a research partner. We shared tools to be adapted to their setting and helped them adapt it. Again, surveys, interview guides, SOPs, protocols, ethics. So we're kind of happy to talk and be open. This is just a couple examples we had of stuff we've done. If you can move on to the next slide. So we have a bunch of inquiries, and just to say, we're on Twitter or X now. We're also on LinkedIn, and feel free to reach out to us on those as well. And next slide. We've been doing a research webinar series. We've had 2 so far, and we want to do the latest news on research and real life examples of conducting research. The format's an introduction to the topic, 3 speakers currently conducting research, 10 minutes each they have, and then time for discussion. And we also have live captioning in French or Spanish. We've been uploading those captioned to our YouTube channel, and we have a YouTube channel where we're putting those up. If you go to the next slide. We've had 2 webinars to date. One is on research gaps and one is on case area targeted interventions. Here's a QR code for the project YouTube channel and the webinar recordings. We're planning right now for fall. Right now we're in the process. We'd like to do 2 more this fall on the value of coordination, chlorine taste and odor, and or wash insecurity. So we want to get those 3 rolling for, you'll see announcements come out about that. And on to the next slide, please. We're doing some training on M&E&R to LMIC institutions. This can include in-person trainings to WASH research academics that would like to be engaged in M&E&R on WASH and humanitarian response. Again, it's the topics, research design, grant writing, ethics, data collection tools, report writing, preparation of manuscripts. Right now, we've been reached out to by a number of WASH clusters for support, but we are still looking for LMI academic institutions if anyone is interested. And on to the next slide. And so just to say, we're working with the WASH Cluster and Tufts, funded by BHA, working with NGO partners, and looking to work with local academic and research institutions. And next slide. We're funded to provide research and travel, but we're not funded to provide partner research costs. That's one bit. We can support the research, provide technical assistance, but we don't actually have the funding to conduct it. And the next slide. I think I'm wrapping up now. So please contact us. We have a project 2-pager on the Global WASH Cluster website. Feel free to link to that. Please contact us to suggest webinar topics, express interest in presenting, ask for research support, recommend LMIC institutions, ask for questions, or get involved in any way. This project has really been about providing support to BHA partners to help meet this research agenda that BHA has put forward. And so thank you so much. That's my 7 minutes. And I'm happy to take any questions in the Q&A.
Yeah, Great. Thanks so much, Danielle. We're going to hear now from Toby, who is the Director of Technology at COST. So over to you, Toby. And then after that, we'll have Q&A on both of the sessions.
Great, thank you. Thank you for inviting me. Yeah, I'm Toby Gould, the Director of WASH Technology for the Center for Affordable Water and Sanitation Technology. A bit of a mouthful, so COST works well. Can we move to the next slide, please? So COST has been involved in 3 BHA-funded projects. WASHM is the first one. You might well know that as humanitarians. A hand hygiene program, training and a program development app for hygiene programming in emergencies. This was set up, run by Action Contrôle Femmes, and we were a sub-grantee there. So for us, that was a great introduction to working with BHA. That's continuing. I'll talk a bit more about that. We then developed a separate program on tech top-ups. So 42 very small learning tools translated into 4 languages, and are now just starting a 3rd funded project by BHA, the scale up and delivery of in-person, hybrid and online learning for local WASH practitioners. So not quite such a catchy title, but there we go. If we can move to the next slide, please. So WASHM, the website's there, washm.info, is basically an evidence-based rapid assessment and development for a hand hygiene program in emergencies. So it would take about a week to do. There's 2 main components: the program designer, so a web-based application that takes your research in the field or in humanitarian applications and develops it into a program, and then the training behind that. The training is either self-directed or facilitated online or face-to-face. At the moment, we're running an online training. I'm involved in that. And yes, we've got 60 or 70 people on that. So yes, the great thing about it, it is very much evidence-based. And the combination of ACF with their field experience, London School of Hygiene and Tropical Medicine with their research, really strongly backing this evidence-based, and ourselves in terms of developing the training and running the training with them, seems to have worked really well. Although it's the BHA funding was time limited, the program itself is continuing and has been it is successful. So if you want to be part of that, either go onto the website to have a look at the training and get involved in the training, or download the program designer and try it out yourselves. Could we have the next slide, please? The second BHA project is tech top-ups, which we ran by ourselves, having learnt a lot of good lessons from doing it jointly with ACF and LSHTM. So this was a short project just to get us involved with BHA very much. So 42 micro learning, so videos, fact sheets, online trainings, posters, that kind of things. And again, translated into 4 languages: Arabic, English, French, and Spanish, with specifics on drinking water quality testing. So a short video and fact sheet on water sampling, possibly, 12 in water treatment, especially around chlorination. So a nice little app on calculating chlorine dosing, 10 on sanitation, and 10 in behavior change. So these you can really take and use as you will. So you can put it into your own trainings, put it into your own documentation, download them, use them, adapt them as you want. And if you can, tell us what you want to do with it. What you've done with them would be really helpful for us, so that we can understand how well they're being used and understand what further uses we can do with them. So that was a couple of years, a smallish program with BHA. And finally, sorry, next slide, please. Finally, a project we've just started this month with some useful discussions with BHA in where we're going with it, the scaling up the delivery of learning for local WASH practitioners. So this is quite a complex program looking at online, so in-person, online, and hybrid learning for WASH practitioners, with a real strong emphasis on local actors working in emergency contexts. So again, we're looking at 160 WASH resources being developed, making them easily accessible in local languages, easily downloadable and shareable. We're looking at supporting 30 local training organizations to carry out humanitarian WASH training and more and capacity development in more detail. So that we strongly support local training organizations generally, and so we're looking to expand that. And also what we're calling an integrated delivery model to individual WASH practitioners. So carrying out training courses on non-network WASH, especially around drinking water quality testing, a Q&A service, a bit like Tufts. So Q&A service working again in local languages, and continuing and expanding existing forums and networks that we run. So we're very much in an early discussions around this, about where we want to go. And what we've really found useful has been BHA's flexibility and willingness, and our flexibility, to be honest, to discuss on what we should be doing, how we should be doing it, and where we should be doing it. So we're continuing those discussions in the early parts of this project. And yeah, it's for us, it's quite a change, but is really quite exciting to be working with BHA on new ways of delivering to local actors. So final slide, please. So thank you very much. Please contact me, tgould@cost.org or cost@cost.org for more details. Have a look at the websites for the tech top-ups and for the WASH'em, and yeah, get in touch with us if you want to know more about what we're doing. Thank you very much.
Great. Thanks so much, Toby. And thanks again, Danielle. We have about 10 minutes for questions right now. So I'd encourage partners to raise your hand if you would like to unmute and ask a question. But I will again kick us off. I'm seeing a lot of questions in the chat earlier in the call around how to engage with BHA on research and capacity strengthening. So I want to ask both of you, what are your reflections, tips, and suggestions for working with BHA on the capacity strengthening and research agenda? Maybe Danielle, you could kick us off with some tips and reflections from working with BHA on research.
Yeah, we have had a series, I think many people on the call know, Tufts has worked on a series of operational research pieces with BHA. There's been some great funding on under-researched interventions and Ebola and cholera and COVID. And so I guess for tips, I would say it's really understanding the balance of the research is really meant for operational. So there's kind of pure research, which we think about like National Science Foundation or NIH funding, kind of theoretical, but the space that BHA is that we've been funded from BHA is really on this operational research. How do we conduct research in actual programs to provide input to make programs better and change policy, right? To help move things forward. And so that's kind of finding that space and knowing little things like when I talk to people who want to do research with BHA, the first thing is like, don't say refugee, right? Like BHA is focusing in IDPs and figuring out where the overlaps are. Because I think the BHA funding for research is really powerful and has really moved the sector forward. And it's finding those places where that research, like what Toby presented with WashM, something that's really gonna help the sector move forward by providing research results that can be incorporated into practice.
Yeah, great. Thanks so much for that. Over to you, Toby.
Sure. So we're a fairly I would say we're non-typical BHA partner. With a fairly strong development focus, but BHA have been very open to us to discuss areas of commonality and coming together of our priorities. So for us, it has been strong discussions around where we could work together and identifying joint priorities. Also, it was great to be a sub-grantee to begin with, to understand how BHA funding and reporting works. And we put quite a lot of effort into that. I talked to our grant manager yesterday, and he said, really being on top of reporting, being on top of USAID's eligibility requirements. So accountability to affected populations, SAM registration and renewal, that kind of thing. And being good at grant management. So putting time and effort into making that work. I know that that's perhaps the less exciting part, but getting that right is also important. So yes, aside from, as he said, delivering top-notch micro-learning materials. So making sure what you do is cutting edge and top-notch. Thank you.
Yeah, great for that. Thank you for that, Toby and Danielle. Danielle, I have another question for you. We're seeing a lot of different topics that partners have questions on in the chat box, different research interests, everything from water resource management to wash and nutrition. So I'm curious, what type of research questions are partners already coming to you with? You mentioned a few of them during your presentation, but are you starting to see themes where there's a lot of questions on, water chlorination or water nutrition? Can you tell us a little bit more about that?
Yeah, so I think I can box them up into some different boxes. So the first box is interventions, and that's what a lot of the research in the past has been on. So like very specific, like water trucking or chlorination or chlorine tablets. And what we see in interventions is there's been a lot of research on individual interventions, but there's people are interested in adapting that research for a local context. So like I know the research on water trucking internationally, but I'm interested in hearing in my context. And so I think that's one box we're seeing. But then I think one of the places there hasn't been a lot of research, and I've heard this talked a lot about today, is in service delivery mechanisms. And not just this sense of like what's bucket chlorination or what's water trucking, but more how are those delivered and how's that sustainable? And so we're seeing a lot of questions on CATIs, case area targeted interventions for cholera. We're seeing a lot of stuff on the systems stuff. So we've been doing some write-ups, some summaries of literature to send out to people. It's hard to read a paper. It's very hard to read 10 manuscripts and understand what all 10 say together. So we've been trying to pull together literature for that. And I think that's where what I'm seeing, this bucket of service delivery, I would put all that in. Not the interventions, but how they're delivered. And then I think the third thing we're hearing a lot about is how to work in contexts where, this has been alluded to all today, travel is more restricted, there's more conflict, climate change, we may not be able to access locations. The same way, it's not like you send a researcher on an airplane with all the equipment. That's not as possible anymore. And so how to work with local partners. And that's part of the localization agenda, how to do much more research at the local level. So those are probably the buckets of questions we're getting, along with how do you take those results and then get them into a format that people can use. So for example, in Venezuela, they have a ton of survey data across the country, but they want to have an easy one-pager that people can click on and see the results, and we're helping with that. So that's kind of what we're hearing. And over, I think. Thank you.
Yeah, great. Thanks for that. I want to go ahead and invite Abel Kasim to ask your question.
Thank you very much for a very nice presentation. I want to say thank you both the presenters. Maybe I want to ask kind of a couple of questions that might be helpful for future, how to enhance research, how to enhance organization, how to also integrate like in intervention, as we say earlier in the presentation. We saw that infrastructure, research, and capacity building we saw in the earlier presentation. At the same time, also see there's a difference in hand hygiene areas. Maybe the point that I want to share is a very nice idea and the area where it is, but we need to have a kind of means that localization has to be linked with research. So that means localization need to have a kind of complementary, how they extract that best practice, that lesson, that might be helpful for the global context, or that might be helpful for others, other reference, or other lesson learners. So on the other hand, maybe the point I want to emphasize, when we have the BHA program, we have a 1 year program. I don't know, this is 1 year maximum, I think so. So we might have a room to space for at least to have a kind of research paper. Rather to use like inline survey, it might be better to have a complementary of inline survey, like kind of research, to have an ice break about intervention, about the service quality, about the context, what it looks like. That might be helpful for the next implementation. That means we might have enhanced the high quality intervention within the time frame. So in this line, what I want to ask a question, how our research is really touching the ground context. Do you have any basic experience that you have done research, which will helpful for others? Like an examples. It might be, for example, currently we have faced challenge of chlorination. I don't know if there is a chlorine is high length pipeline, there is a chlorine decay process. That chlorine decay process might have its own effect, which is decreasing of the chlorine concentration at the end of the end users. So such kind of issue might require further understanding and rather to be aligned localization process. So this is a really very nice platform that we learn, that we capture everything. At the same time, we can also have practice when we are implementing on the ground. So this is maybe the point, how research, localization, and capacity building link each other. What the context that you are going to do? You have any other platform or kind of in the future that you are going to do, or do you have any evidence that you are doing right now? Thank you. Back to you.
Yeah, thanks so much, Daniela and Toby. Any thoughts?
Hello?
Yeah.
Can you hear me? Oh.
Yeah, I can hear you. Turning it back to, I heard in there different elements around localization, both for research and also on capacity strengthening. So maybe Danielle or Toby, would you like to take a chance at a response?
Okay, so in terms of localization, yeah, we strongly, both in terms of capacity building, but also to a certain extent in terms of research, it has to be strongly with the local partners are leading the initiative. that the context works incredibly well. So we've got some basic sets of materials that we can further develop. When I say we, that typically the local partners develop, both into local languages and change into local context. We also, to a certain extent, are looking at research, not to the same level as Danielle, but very specifically around operationalizing things like chlorine dosage, taste and odor, how that works in specific local contexts and with specific issues around the geology and geography in country, and people's the taste and odor issues are very context specific. People like the water that they know well. Adding chlorine is going to be much more difficult. So bringing in that in terms of materials that we put out is definitely important.
And maybe just quickly, I'll add one thing, which is I think people think there's a tendency when we say research maybe to think of something that's like a 3-year program and a randomized control trial. And I think one thing that's really important in the humanitarian sector is that a lot of operational research is needed. And to me, that's something that can be done on a much faster time frame from a local level. It doesn't have to be this kind of very fancy 3-year RCT. It can be a program evaluation or even program monitoring that can really inform how to do response better. And so I think a lot of what you're saying around localization and operational research, program monitoring, program for continuous improvement, that is also something that I consider research and that is really important and can all be done within the timeframes of kind of BHA projects.
Yeah, thanks so much for that. Thanks for the question and for the additional questions that have gone into the Q&A. I think to conclude this part of the discussion, I'd just like to thank both of you for sharing your experience. I also noticed that both of you are really focused on localization. So Danielle, you mentioned around working with low and middle income country researchers on the research agenda. Toby, you mentioned this new project with BHA is really focused on local partners. And so I think all of the BHA partners who are on the line, I would encourage you to reach out to Danielle and Toby directly and also see how best to continue to foster and strengthen those linkages between the local organizations you're working with and Danielle and Toby's work. So thank you so much again for sharing during this meeting. I'm now going to pass it back to Matt to continue to talk about how to stay involved with the agenda. And from the number of questions that are coming into the chat box, I think this is something that partners are really interested in learning more about.
Yeah, thanks, Nicole. And just to note, we're pretty limited on time, so I won't have time to get into all the nuances of how to work with us and what that looks like. I know many of you have worked with us in the past on emergency programs, so you know a little bit about the process, but I'll try to get into a little bit of detail here on how to find information on how to work with us. So next slide. So in general, I'm sure you all are familiar with this site, the workwithusaid.org. This is a lot of the general information that you'll need if your organization hasn't worked with USAID. This is kind of how to get started. There's good guides on here on the steps that you need to take in order to be able to work with us. It can be quite a process. So if your organization hasn't worked with us before, this would be a good first step to go here. There's other information on here as well for support for current partners. Next. So specifically to BHA, if you go to the link provided on this slide, usaid.gov/humanitarian assistance/partner with us, you'll come to this page. If you scroll down on that page, you'll find a few different areas. So the first is non-competitive. That's how most of our funding works typically. We have separate guidelines for NGOs and resources for public international organizations. So whichever one of those applies to you, that's where you'd want to go for information on how to submit a concept note, things like that. But I do want to highlight the second box here, the competitive area. So under competitive, you can look up our annual program statements. There's also links to the business forecast, which might give you an idea of things that we're looking at down the road in terms of competitive awards. But typically, most of our funding is going to move through this non-competitive mechanism. So if you're an NGO, you would click the NGO Emergency Application Guidelines link, which would bring you to the next slide, where you can find the emergency application guidelines. And so here you'll find the common requirements for all of our applications, as well as the sector-specific requirements. And I want to highlight for concept notes in particular, the information that you'll need to understand how to submit a concept note, what information we expect to see, that is under the common requirements PDF. So that's a good place to start to find information on concept notes. So if you'll go to the next slide, please. If you click that common requirements, it'll bring you to this Google Doc, USAID BHA EAG common requirements. And then you can just search for a concept paper. That's section 7 under this. And there's lots of information on here. What does the submission process look like? What should these concept papers have in them? Where do you submit them? How are they reviewed? All of those things are supplied here. So this, I think, is the best place for you to go. If you're interested in submitting a concept paper to us, all the information you need is in the common requirements there. If you're not familiar with the emergency application guidelines, we do have an emergency application guidelines tutorial that's linked on this slide. I believe if someone could maybe copy that in the chat, that would be helpful. But that'll give you an idea of kind of how our emergency application guidelines work and more information you need there. For competitive opportunities, like I mentioned, the Partner With Us page I shared earlier has links to places where you can find out about our competitive opportunities, but grants.gov is also where you might find some of those. So for concept notes, they're described in the common requirements, but one thing I wanted to note is that these concept papers might not actually be submitted under the WASH sector, even if they focus on WASH. The way that we work, some of these will be submitted under humanitarian policy, studies, analysis, or applications. Ultimately, that comes to us to review and to provide comments on, but sometimes it ends up being under a different category for these research activities or capacity building efforts. So just take a look at this section in the EAGs. It should be helpful for you all and kind of giving you a primer or a brief on how these concept paper submissions and review process go. So unfortunately, I don't have a lot more time to go into how to work with us, but as we've talked about before, we accept concept papers all the time. So anytime that you'd like to submit one, you absolutely can. There's no guarantee that we'll have funding available or be able to fund any work, but we're always interested in hearing ideas and would love to hear from you all, especially as you have ideas and programs in mind that align with our research and capacity building priorities, as those are the areas over the next 4 to 5 years that we're most interested in addressing. Next, please. All right, I'll pass it back to you, Nicole.
Yeah, thanks so much, Matt. And I'd like to turn it over to Melissa to add a couple of thoughts and reflections based on the conversation so far in this meeting, as well as some of the questions that are coming into the Q&A.
Thanks, Nicole. And there's some great questions coming in, and you'll see I did add some comments in the chat about can we answer all of the questions that are in there. We will try to bundle them because I do appreciate the questions. They're all great questions. There's some that overlap, and so we will pull them together to address them kind of thematically. But one piece of follow-up from what Matt said, this capacity building, research and capacity building agenda was really a way for us to prioritize. There's so many things out there to research, so many interesting things and gaps that we know of. And we felt like we were sort of sprinkling here, here, here. We needed to get together and really hone in on what were the critical areas. And really, thanks to some incredible work that Matt did, and we have come to this point where we can kind of really have our set of priorities, and it's set for the next 5 years. So we would love to have a budget where we could approach all of these topics in one. We'd probably be a little overwhelmed by that, but so we also know that going into this next year, we're getting some pretty strong indications that we have a very tight budget. So we won't be able to address all of these at once. So I would ask people to look at where your own organization's priorities are. Please do submit a concept note to the WASH team. If one of these particularly resonate, you have the capacity to take it on, the time seems right. We don't know quite what we don't know at all what our funding horizon will be for the next few years, as always. But also there were some questions in there if they're country-specific projects that you have, because our budget isn't big. It is for global learning and global support, but country-specific programming can often be wrapped into your implementation and have learnings along the way. And again, I think that can be, there are a number of NGOs that have done that before. And if you're already implementing, you have the capacity to build in some research with that will inform the project going forward. It's very worth talking to the BHA field team about wrapping that in. Everybody has very tight budgets ahead, we're being told. So take it with a little bit of caution to know that this is a challenging area to get the funding for. But as Danielle was talking earlier, we're really interested in how can we do this better? How can we do it more efficiently and effectively? And our field teams are too. So if you can make the case, if it can be wrapped into what's happening, there are opportunities out there. So I hope that helps. I also did see a number of questions about kind of longer term resilience programming. Unfortunately, we are not able to tackle that. Our development colleagues we are very much in conversation with them. We've, in the last few years, had much closer discussions and work to see how we can link better. We've got a long way to go on that. But I would say the Center for Water Security, Sanitation, and Hygiene is a good place to tap into for the longer term programming. Thanks.
Great. Thanks so much, Melissa, for taking time to address the questions coming in. We're now going to move on to the last portion of today's meeting. And this is a ranking exercise that we would like to do with all of the partners on the line. So during registration, we asked you for your priorities, and we also asked the BHA WASH advisors for their priorities for these meetings. So we will be organizing these biannual meetings in collaboration with the BHA WASH team. And we wanted to make sure that these conversations are the most useful that they can be for emergency WASH partners and for the BHA WASH advisors. So we heard a lot of different priorities from partners, and today we are sharing the top categories that we heard from you, from the emergency partners, and from BHA. We'd like to hear from you, and we'll ask you to vote for your top 3 topics. What do you think we should discuss at the next meeting that we'll organize between emergency partners and the BHA WASH advisors? I'm going to go ahead and read the list of priority topics so that the interpreter can also translate those to French. We heard from you that you are interested in talking about identification, assessment, and monitoring of WASH needs in displaced settings, emergency drinking water quality, linking to other sectors, WASH and multi-sectoral interventions, sustainability and ownership, WASH capacity strengthening, training, expertise, and effective mechanisms to build capacity of WASH professionals, construction quality, WASH funding, climate resilient WASH, including climate resilient water supply and sanitation infrastructure, accountability and user-centered design and user satisfaction, localization, NFI kits, products, and sustainability of NFIs, behavior change and outbreaks, including to dispel disinformation or myths, fecal sludge management, and WASH and inclusion of persons with disabilities. So these were the topics that during registration and during conversations with BHA rose to the top as priorities. Now, my colleague Suzanne will share in the chat box a link to the AHA slides where you can vote for your top 3 topics that you would like to talk with BHA about at our next meeting. So you can either scan this QR code to join, or you can go to ahaslides.com/KA8WT in order to vote. We'll just give another minute or so, as I see 55 people have already joined the AHA slides and would love to get a critical mass helping to decide the agenda for the next meeting. If you are voting on your phone, please note that you will need to scroll down to see all of those different topics. Yeah, so we're gonna go ahead and move on now and look at the results. Let's see, so Suzanne, can you confirm, is that WASH funding or climate resilient WASH that rose to the top?
I
Looks
believe
like-
it's WASH funding. We're going to have to double check that in the back end.
Oh, it looks like it's 1, 2, 3, 4, 5, 6, 7, 1, 2, 3, 4, 5, 6, 7. WASH funding looks like it's 3.3%, and climate resilient WASH is about 20%. Yeah, so climate resilient WASH rose to the top, and linking to other sectors, including WASH and multi-sectoral interventions. So climate resilient WASH is a very large topic. And so we now want to hear from you. What is it about climate resilient WASH that you would like to discuss at the next meeting with BHA? So go ahead using the same link. Tell us more about this topic. What about climate resilient WASH would you like to discuss at our next meeting? And if you're having trouble joining AHA Slides, you can also drop in the chat box what about climate resilient wash you would like to discuss. So I'm seeing solar powered water supply systems, practices, mitigation, hazard mapping, M&E, governance. Wow, lots of really important topics. We'll just give it another couple seconds for people to add. Great. So please do continue to type, and we'll take this information and organize it and discuss with BHA and likely some of you to plan for that next meeting that will take place in about 6 months from now. Since this is our first meeting and we would like to organize these on a biannual basis, we would also like to hear from you on what went well during today's meeting and what could be improved for our next meeting that we organize with you and BHA. Suzanne, are you able to advance to that next slide? Great. And so in the next minute or two, we'll just ask for that feedback on what went well and what we can improve for the next meeting. I see there's a hand raised. Adonis, do you want to go ahead and ask your question or provide your feedback?
Yes, it's a question. Thank you. There was a question in the chat box which wanted to find out whether or not you are going to be able to share with us all the slides, or maybe even the recording are going to share with us.
Yeah, great question. Absolutely. If you registered for the event, which I think all of you did, if you're on the line, we'll be sending out the presentations and the recording after the event. Absolutely.
Okay, thank you. I appreciate it.
Yeah, great, thanks. Good. I think we'll move on to how we can improve. And I think as you answer this last question, I will also take this opportunity to invite Melissa to have any closing remarks, and as we are nearing the end of the meeting.
Yeah, thank you, Nicole. I really appreciate you facilitating today, and impressed right at 5:30. You kept us on time. Thanks to everybody who joined, and a huge thanks to Danielle and Toby. Those were great presentations, and the ongoing work you all are doing has really helped tremendously. Thanks to Matt. Nicely done, great answers, and we will get more responses out to everybody as well as the presentation, and truly appreciate being able to speak directly with you. It's certainly, you are all the ones that are connected directly to the work, and that's so critical. So look forward to continuing the conversation, and hope you have a very good rest of the day. And I am seeing that there is an evaluation in the chat. Please take a moment to go to that. We really need your feedback. Great. Thank you.
Yeah. Bye.